Hi everyone, I'm going to be discussing the different styles of sections. To make this a little bit more interesting and rememberable, I'm going to be showing different sections through the world of The Sims to provide a visual aid as to what happens throughout the process. I will be addressing some of the most commonly used sections under the Mental Health Act, sections 2, 3, 5, 37, 41 and 136. So to start with, we will look at sections 2 and 3. Under Section 2 and 3, individuals are sectioned under the Mental Health Act by two approved mental health professionals, usually doctors. Individuals on a Section 2 and 3 will be kept in hospital against their will for doctors to decide what kind of mental disorder they suffer from, if and what treatment they need, and how it may affect their health. Individuals under this section will be introduced to the doctors and nurses upon admission, going through ward rules, history of the patient, and what is going to be expected from the hospital stay. The individuals will then be escorted to the ward and have an orientation. While in hospital, this allows the patient to have appropriate treatment at the hospital that they would be otherwise unable to access unless detained. This may involve a range of things, such as therapy with professionals and teaching other life skills with occupational therapists. The difference in the two sections is around the time limit of the hospital stay. Under a Section 2, an individual can be detained for up to 28 days, but can be released any time if the doctors feel they no longer meet the criteria and cannot be renewed, instead moving on to a Section 3. Under a Section 3, an individual can be detained for up to 6 months at a time. After that first 6 months, the section can be renewed again after 6 months, once more. Section 5 is used when individuals who are informal on a ward. This means that the patient is not sectioned onto the ward, but able to move freely from the ward if they decide to. There are two different types of Section 5, a Section 5.2 and a Section 5.4. A Section 5.2 is when a doctor can hold an individual against their will in the hospital for up to 72 hours, if writing a report explaining why they have been detained and sends to the hospital managers. A Section 5.4 is when a mental health or learning disability nurse can hold an individual against their will in the hospital for up to 6 hours. Both of these are used to stop a patient from leaving the hospital for their own health or protection of others. And with the Section 5.4, if it isn't possible to find a doctor who can section under a 5.2. Following a Section 5, the holding powers end after the allotted time slot, unless an approved mental health professional and doctor assess the individual afterwards. Sometimes individuals will not be detained under a section. Moving on to sections 37 and 41, which are typically used in criminal courts when an individual is deemed to have a mental illness that needs to be treated in hospital. A Section 37 can only be used when an individual is guilty of a crime and has been convicted, and when the court agrees that this has occurred but decides not to send to prison but to a hospital due to the unwell to be able to plead their case. Then, doctors need to assess the patient and agree that mental illness is present. The doctor then has to speak in court and give evidence about the condition, when the judge will then decide what level of security is needed regarding the hospital. A Crown Court can make a Section 41 restriction order, only if the judge believes the patient is a risk to the public. This enables the Ministry of Justice to be consulted before discharge, escorted and unescorted leave to aid in making the decisions towards the patient's care. Similarly to the previous sections, the individual will be escorted to the hospital they have been sent to and orientated onto the ward. The patients will often engage in therapeutic activities such as regular exercise and art therapy in order to reflect and work on what happened to cause them to commit the crime they did. They will also have to undergo a treatment program, typically involving therapies, under the Ministry of Justice in order to rehabilitate themselves. Finally, a Section 136 is used by the police if they believe that an individual has a mental illness and needs care or control due to this in the public. They will be taken to a place of safety, which could be a home, a friend or relative's house, or a hospital. A police station will only be used as a last resort if any of these are not available. The police will escort the individual to the 136 suite, giving a handover to the nurse in charge. The patient should be kept in their own room with a professional to keep a close eye on them and note down any changes they observe. Following being detained on a 136, two doctors or approved mental health professionals should do an assessment to gauge the level of mental stability of the individual and understand what has happened for them to end up in a 136 suite. The professionals will then establish if the individual needs to be sectioned under a different category, for example, a Section 2 or a 3. If an individual is sectioned under a different category, a referral will be made from a more secure setting, whether that is an acute bed, a PQ bed, or any of the others that are available that is in a hospital deemed safe for the individual needs. Thank you for listening and for watching. I hope this has helped to understand some of the different sections used within the Mental Health Act. For more information on other sections of the Mental Health Act, I have a list of references in the file section on Teams. Does anyone have any questions?